This is something I feel really, really strongly about, and I want to understand it a bit more. And I'm joined now by social media campaigner June Slater. June, good morning. Lovely to see you. I know you feel as strongly as I do about this. It's not getting the attention it deserves, is it, post-pandemic? What a state our care homes are in.
Considering the industry was already 140,000 carers short, I'm absolutely aghast that they had the nerve to sack 20,000. I'm looking at testimonials here from management of various care homes where they've sent letters of commendation to carers, where relatives, friends and other staff and the residents themselves have thanked them profusely for their continued care. And these people are sacked and down the road. Now, you talk about government U-turns. I'm really anticipating that a government makes a U-turn on this, because I think a government that's making U-turns is a strong government, a government that's listening, that's accepting that it can't get all the things right. We are victims of them getting many things wrong for 2 years. So if Liz Truss is U-turning, Let's Soak Coffee can do the same. Because at the end of the day, this is one issue that needs a massive U-turn on. Reinstate the carers, give them a bung. We can send money for weapons. We can send it to carers, I'm sure. Apologise. Get them back in the industry. We've lost good people with years of experience. Add to that, I don't think people realise just how much this impacts on the rest of our healthcare. Currently, 13,000 beds in the NHS are occupied by people who are fit enough to be released. Most of these people will be released into care homes, but as you've said, because they're still continuing with restrictions, they can't go back, and some staff shortages don't help that matter. But the thing about the restrictions, some care homes are using this because it's easier to run the care home without visitors coming in and out. Now, the trouble is a lot of these daily visitors, and again, I've got testimonials here from people in message box, they actually fed some of the dementia patients. They made sure they ate the breakfast. What's happening now, carers are telling me they've only got the time to change their incontinence pads in the morning. Then they leave them sat there. They're not dressing them because that takes time. They're leaving people in bed. I've got a harrowing story of a man who went in for respite. Respite, that's a limited period. Sadly, we locked down and he was left there. He was in a wheelchair. His relatives used to get him out and support him to walk just to get his muscles moving, back in the chair, back into bed. He had a life. He watched the birds in the garden. He had his family visiting him. He was left so badly in a care home for months on end that when they went to see him, his legs were actually folded up underneath his knees. He couldn't even straighten them out. That's a care home understaffed. That's a care home suffering from rules they should be challenging, not accepting. And that's my gripe.
I don't know about you, June, but I've never met a poor care home owner. Some of the richest people I know personally own care homes. They are very profitable businesses.
The thing is, when you think the cost that they accept for meals per day is between £4 to £6, £6 being the high end, they're the Rolls Royce of care home facilities. Where's the profit going? Let's make a bit less money. Let's treat this a bit more vocational. When you think that if you want to know how strongly the public feel about this, the Together Declaration that was responsible for bringing a halt to the mandate in the first place for the health workers, are bringing out a new campaign about these sacked care workers.